Machado, and today my fellow student nurses Megan Sandy, Nok To, and Priscilla Turan and I will be presenting information on tuberculosis. According to Healthy People 2020, TB can be prevented, yet healthcare systems often do not make the best use of their available resources to support prevention efforts. Tuberculosis is an infection caused by a bacterium called Mycobacterium tuberculosis. It is often found in the lungs but can disseminate to the kidneys, spine, and brain. Infection can result from airborne transmission and usually frequent close contact with an infected individual. There are two types of tuberculosis: latent tuberculosis and active tuberculosis. Latent tuberculosis is infection is present but inactive and the person is not contagious. Active tuberculosis means signs and symptoms are present and the person is contagious. Some risk factors for tuberculosis include an HIV infection, recent infection with Mycobacterium tuberculosis in the last 2 years, a weakened immune system resulting from diseases such as diabetes, end-stage renal disease, cancer and cancer treatments, substance abuse and tobacco use, poverty and lack of medical care, healthcare workers, residential care facility workers, and refugee camp or shelter. Signs and symptoms of tuberculosis include a cough that lasts 3 weeks or longer, a non-productive cough in the morning, chest pain, coughing up blood or sputum, weakness or fatigue, no appetite, chills, fever, and sweating at night. Now, Priscilla will be presenting you with information on stratifications and epidemiology.
TB can strike anyone because it is airborne, but is more likely to be found in people who are born in foreign countries, people who have diabetes or HIV, and the homeless, and healthcare providers since we are direct care providers. Alcohol abuse is associated with more than 18% of the cases. Almost 9% of the cases are associated with long-term care facilities or prisons. People who are aged 65 and older have an increased incidence of TB. And the World Health Organization states that more men than women are diagnosed with TB. However, more women tend to die from TB than men. Some geographical areas where it is prevalent include inner-city neighborhoods, the Texas-Mexico border, Sub-Saharan Africa, India, China, Mexico, and the islands of Southeast Asia. More specifically, some Texas epidemiology includes that in 2011, 1,325 cases were reported. That is a rate of 5 per 100,000. In Texas, 16 people were diagnosed with a multi-drug resistant TB, and that is a more severe case and it is harder to treat, but it was only 16 people. Some more stratifications include that 52.6% cases were reported in Hispanic populations, 18.7% cases were among African Americans, 12.2% were among whites, 16.1% were among Asians, and 0.2% were among persons of unknown ethnicity.
Hi, my name is Nok To. Today I'm going to present the detection, treatment, and prevention of TB. So first of all, I'm going to present the detection of TB. There are two tests that can be used to help detect TB infection. The first one is TB skin test. It is performed by injecting a small amount of fluid called a tuberculin into the skin in the lower part of the arm. And a person given the TB skin test must return within 48 to 72 hours to have a trained healthcare provider to look for the reaction on the arm. And the positive skin test will have the smaller reaction in duration greater or equal 5 millimeter, and the negative skin test will have the millimeter recorded with 0 or no in duration. The TB blood test will be measure how the immune system react to the bacteria that cause the TB. Next one, I'm going to talk about the treatment and management of TB. Drug therapy, promoting and monitoring compliance is very critical for treatment to be successful. Drug therapy with antibiotics with at least 6 to 9 months. For most cases, 2 months drug therapy with isoniazid, rifampin. Directly observed therapy, providing the anti-tuberculosis drugs directly to the patient and watching as they swallow the medication. Non-compliance is a major factor in multi-drugs resistance and treatment failure. Medication side effect. TB med can be highly toxic to the liver. Call the healthcare provider if experiencing some signs and symptoms such as nausea, vomiting, loss of appetite, dark urine, jaundice, fever that lasts 3 to 4 days. Compliance and complete treatment is very important for treatment of TB. Next, we're going to talk about prevention of TB. Do not spend long period of time in enclosed rooms with anyone who has active TB until that person has been treated for at least 2 weeks. If living with someone who has active TB, help and encourage them to follow treatment instruction. Use protective measures such as face mask and careful hand washing. A TB vaccine such as BCG is used in many countries to prevent TB. Screening programs are encouraged to detect individuals with TB. The person with positive TB skin test should have a chest X-ray annually to assess for the progression of disease. As a nurse, we should wear a fitted mask whenever we enter the patient room to protect ourselves from exposure to TB.
So now I'm going to talk about the different dimensions of health. A person's physical dimension of health is greatly affected, as previously mentioned. We have the active TB, which presents signs and symptoms, and the inactive or the latent, which has an incubation period of up to 5 years or slightly longer, which no signs and symptoms are present. A person's psychosocial dimension is affected as well. The treatment and management of the beginning stages of active TB includes physical isolation for up to 2 weeks. This can be pretty scary for patients. They may want their family members and loved ones to be near them when they're trying to be healed from this disease. A person may encounter anxiety while having TB. They have a lot of breathing problems and cough, and so that may make them anxious, and we may encounter that as well. A person's spiritual aspect of health may be affected as well. Some cultures may seek spiritual healing from TB. Some people may have strong personal or cultural beliefs that would affect how they believe the disease should be treated. They may want to turn to particular people or not turn to particular people. A person's finances are also affected as well. Many of the TB patients tend to be the homeless or the foreign-born people in the U.S. And so with this, they may not have insurance, and so that could detriment the compliance and also their ability to receive without having the proper finances to pay for the hospitalization. Hospitalizations tend to be expensive, and also chest X-rays and the medications tend to be expensive as well. So now we're going to talk about the spiritual and emotional support that is needed for a TB patient. It's really important to collaborate with different community agencies to bring this support that the patient would need. One way to bring that support to the patient is through case manager. The case manager is involved with the patient. They get to know the patient well, get to know their personal beliefs and their needs, even cultural needs. That can be important. Cultural needs is a huge thing to reach for the patient, especially regarding spiritual and emotional needs. So this may include direct observed therapy, which is very important for the homeless population. So this includes the healthcare worker observing the ingestion of the medication. Also, another important thing for the patient is incentives. This may include small rewards and encouragements or motivations for the patient. It may include organizations and other resources such as grocery store vouchers, nutritional supplements, movie tickets, or even restaurant coupons. There's also a thing called enablers. And enablers they bring about free van transportation or bus tickets. This may include small reminders, letters, or even phone calls to the patients to remind them to make it to their appointment. Compliance, as mentioned previously, is very important when treating and managing TB. There are also some TB services that are provided in Texas. It is important as nurses, as we're working in different hospitals in our state, to know the resources that are available to give our patients. The Texas Department of State and Health Services provides many of these. One is a TB program manager, TB group manager, nurse consultant, drug-resistant TB program, and also a TB genotyping program. All of these numbers and resources are available on their website, and so if we ever encounter a patient that needs these resources, we can locate those numbers to provide that for them. It is very important as nurses working in the hospital system to identify the signs and symptoms, to know whether it's latent or active TB. TB is a preventable disease, and so it is important that we continue working with these preventable measures as future nurses.